Would more treatments, like per day, per month, per year, help improve the results even further?
That's an interesting question. For macular degeneration and most neurological conditions, in my experience, it's not necessarily more, but it's more of a more frequent, intensive bursts of treatment. So, for example, we'll treat patients, 2, sometimes even 3 times a day initially, just to see if it's almost like doing CPR. We want to get a really good response and see if the person is going to respond. We don't want to drag people along and maybe it's going to work, maybe it's not. You think you see better, or maybe you don't. Within that short time frame, we can see if there's a measurable response, and if there is, we continue. So that's our model that we use. But more isn't necessarily better. So, like, for example, we treat people for 2 weeks at a time, and a lot of people ask if they can I stay for 3 or 4 or 5 weeks? It's not necessarily gonna help. We need a little time to rest, because that's when our body recovers. And we'll usually have patients come back sometimes maybe 6 weeks, sometimes 3 months later, or 6 months for another round. But it's more like intensive rest. That seems to be the most successful way to treat macular degeneration in my experience.
Correct.